Welcome to the Catalyst Podcast. I'm your host, Charles Epstein. Today, I'm joined by Jessica Hulsey, President and CEO of the Addiction Policy Forum. Jessica worked in the addiction field in 1992, just some career highlights here. She was appointed by President Bill Clinton to serve on the Drug-Free Communities Commission and served as a legislative aide in the U.S. House of Representatives on drug policy issues. And in 2015, Jessica founded the Addiction Policy Forum, and she joins me today from her home and office, I suppose, one and the same, in Potomac, Maryland. Hey, Jess, how are you?
Oh, great. Thanks so much for having me today.
Oh, thanks so much for making the time. Really do appreciate it. So, tell us a little bit about the Addiction Policy Forum and what led you to found it.
Sure. So in 2015, I started the
Oh, and
addiction.
by the way, I apologize, but should I congratulate you on your 10-year anniversary, or is that coming up?
Oh, no, yeah, that was in March. Thank you so
Oh,
much.
okay.
Yeah.
Belated. Okay.
Yeah, no, I appreciate it. It's very exciting. So in 2015, I started APF for a couple different reasons. I've been in the field for a really long time as an impacted family member. Did a little bit of work in policy and other spaces, and I still felt that there was more opportunities to bring patients and families to the table, to do a better job of translating what works and what doesn't, and more about this illness to our community. And also to kind of take a big tent approach to have everyone, including key stakeholders, at the table. And we really dug in, focusing on advocacy and policy issues and creating more resources for the field. And since we've sort of developed and created new initiatives as we find areas where there's gaps or needed resources that we hear from our community. So that's sort of the background of it.
Okay, good. Actually, we're going to come back to this toward the end of our conversation. We can just sort of look back, since 92 in the last 10 years, some perspective on some, major changes that have happened in the field. So, yeah, I want to get into your work with APF, Addiction Policy Forum, some of the challenges you're facing these days. We can certainly intuit what some of those are, your priorities and your organizational goals.
Yeah, sure. I think one of our major priorities at Addiction Policy Forum is tackling the stigma around addiction. A lot of different health conditions are stigmatized, whether that's HIV or mental health or obesity, but addiction is really the most stigmatized health condition in the world. And that stigma keeps patients from seeking help, it keeps families from reaching out, it delays treatment, it sort of kind of shuts down so many different options, early intervention, and evidence-based care. And it's fueled by lack of knowledge, lack of seeing addiction through a health lens. Traditionally, we've been not integrated into healthcare. So we have a lot of myths and misinformation that still persist and that are kind of widely kind of endorsed and understood as like sort of norms in our families and communities. So tackling those and correcting misinformation, building knowledge to reduce stigma and reduce the discrimination that individuals with this health condition face is really kind of at the heart of a lot of the work that we do today. We've
Mhm.
developed new interventions to eradicate and to fix stigma. Really been curious and building those resources so that we have
Mhm.
more tools in our toolbox to tackle
Right.
addiction stigma. Sometimes we get very focused on changing our language, and that's sort of the low-hanging fruit of stigma eradication. Really, what we need to do is build literacy, which is a combination of knowledge about the illness, intention to help, and confidence or sort of self-efficacy on knowing what to
Mhm.
do. And so a lot of our work over the last 5, 6 years has really focused in that area.
It's obviously not a new problem, obviously a very stubborn problem. And you're talking about education and all this to lower some of these barriers, some of these stigmas. What are some of those tools? I understand the problem, I understand the goals, I understand how broadly you can attack it. But what are some of the actual tools that you're using, and what are you seeing as far as the efficacy is getting some of this stigma to diminish?
Yeah, so some of the tools that we've built, and really this is like the some of the space where we're trying to fill gaps that exist in the field. So in partnership with the governor of Ohio, starting in 2020, We started testing and pilot testing our first anti-stigma intervention, which is really for families and a broader community, and that's called Encompass. And our data was published in the Journal of Addictive Diseases earlier this year, and showed that the 8-hour program, increased knowledge and decreased stigma. And we're really using validated evidence-based measures and how to measure stigma. So we reduced stereotypes, sort of those inaccurate thinkings. So I think of stereotypes as the thing that are in your head, the inaccurate thinking about people in recovery or with a substance use disorder. It changed prejudice, so the feelings that we have towards a group of individuals, and it also changed discrimination intent. So we have real data. We partnered with researchers at the University of Delaware to test our program, and I feel like it was a very important milestone, both for Addiction Policy Forum and for me in my career to finally, because we haven't had a ton of interventions in this space. We have so many on the mental health side or the HIV side, and even education programs for patients and caregivers for diabetes and Alzheimer's and autism.
Mhm.
We've had a lack of those same resources in the SUD space. So we sought and we started out to fix that and build one, and we're really excited that it's available. It's a train the trainer model, so we have about 400 certified instructors all over the country that are delivering Encompass every week.
Interesting. Has telehealth technology had any real impact? I mention this in part because we just wrote an article on using telehealth for interactions between peers on one end and people who are in the emergency room on the other to just deal with the issue of overextended ERs. And the recent study was kind of inconclusive, although we know that there is great deal of efficacy with telehealth platforms and various types of interactions. We also know that peers can be very effective. So, are you able to use any of these platforms, any social media? Has any of that been particularly efficacious? In social media, I can see going in the other direction.
So we use a variety of formats to deliver educational materials.
Mhm.
And in our science translation piece, every time that we're sharing a new study, a new intervention, a new treatment, a new medication in the SUD space, we're really focusing on stigma at the end of the day because we're reminding people in the public that it is a health condition. We have a medical subspecialty. We have researchers that are working on innovations and advancements every day. So all of this sort of, I think, is part of a broader stigma reduction effort. So we have little items that go out through social media and through, I think we have over 80,000 people a month that are on our YouTube channel with, we do a lot of animations and cartoons and video explainers and talking head explainers to introduce people to some of the best and brightest in our field. So I do think that those can make a tremendous difference because we need to change the access to information for patients, families, caregivers, and community members. Too often, information about what you're supposed to do about addiction to
Yeah.
prevent it, to intervene early, to treat it is behind paywalls and gate kept. And so, really, what we're trying to do at Addiction Policy Forum is change that so that everyone can have access to information about how do you prevent, treat, recover from a substance use disorder, similar to other disease spaces. We don't make folks in the diabetes or cancer space pay first or sort of pony up dollars or jump through so many hoops just to learn about the illness. So how different of a place can we be 5 or 10 or 15 years from now if we change fundamentally the access that to information that our consumers have?
Yeah, no, sure makes perfect sense. I want to come back to the topic of families in a moment. When we spoke, you used the term bench to trench gap, referring to addiction research not translating into real world practice. Pardon the plug, but bridging research and implementation is one thing Chestnut does particularly well. But I'm sure there are several things that account for this gap. What are one of the two most consequential?
Well, I agree that Chestnut is a leader in this area and does an amazing job of translating their own findings as well as other work that's happening in the field. And that bench to trench or sort of the science to practice gap, that's not just in our field. That's sort of all the literature that's available on this gap, which is this, Literature says around it's a 17-year gap, but in our space, it's much worse than that. I am still on a weekly basis out training community members and families about the outcomes and the efficacy of methadone and buprenorphine and all of the treatments that are available and the need to intervene early and not wait for rock bottom. So we have even more gaps in the uptake of evidence-based practice. Some of that comes from misinformation, not lack of knowledge and education. We don't know that this is a health condition. We don't know there are doctors that you can go and see to treat and prevent this illness and recover and have a great prognosis. So all of those pieces, I think, sort of feed into that. And I think our science to practice gap is actually a little bit more severe than in other fields. And we can do a better job by pushing information out directly to families and communities to making science understandable. We
So,
always,
so I'm sorry, Jess. So the bottleneck is actually on the other side, acceptance in the community among parents.
well, I think
Where's the
remember, this is not a science to practice gap, isn't just in our field, right? So ours might be worse, but most practitioners or families are not reading journal articles. We don't, some of them we don't even have access to if they're behind paywalls. So when we don't, have pathways to make sure that both practitioners and individuals impacted by the illness have access to new knowledge and innovation, that's where we can end up with one area of gaps. And then on the other side, if you don't know that it's a health condition, then you're not sort of looking for information from that space. So I think we actually have to come at it from both ends.
I see. So both equally complicit, if you will. So the topic of families, unless there's anything else you want to talk to about this gap.
No, just I think we're really proud of the work we've done in this space, and I feel like we've learned so much since we started APF. One of our very first science translation pieces we did, I was like, oh, let's just make sure that everyone, even like a high school or middle school or our family member, can understand how addiction affects the brain to
Mhm.
really better understand it from a health lens. And we thought, oh, first we'll get a bunch of neuroscientists to do a quick spiel for us, and it didn't go over very well. It was really actually
Mm.
hard for families and particularly for families or individuals in crisis to absorb that information. Because when you're in crisis, I think you learn a little bit differently too, right? You're worried about someone that you're worried about losing. It's a very severe illness. So we have to, I think, up our game on how we make sure that we translate and make content and science consumable. So we did our first piece and we turned it into an animation, sort of a cartoon. And I thought, oh, well, we have a format and we have a focus group of families, and I have these amazing scientists at NIDA, and we're going to put it together. We'll be done in 6 weeks. 9 months later, we finally finished our first science
Uh,
translation piece because you have to make sure that terms are understandable, that we are meeting our audience where they are, whether that's family members or patients, individuals in treatment, or law enforcement officers and corrections officials. And I think that we've really been dedicated for the last decade to really making sure that high quality science translation is available for this disease space.
it's kind of interesting because earlier in this conversation, we're talking about sort of literacy or just education. It's more than just language, but obviously language is important in not just educating, but in the moment we're living, we all have to sort of thread the needle and be mindful of certain language that may get a certain reaction. It may strike some as being politically charged, etc. That being the case, and I'm assuming that's also a broadly shared thing, regardless of the kind of research, regardless of the type of work you do. I'm assuming that's the case in this work. Is that also contributing? Or do you see that further contributing to some of the problems, some of the length of time it takes to bring stuff at the level of being ready for implementation or just simply implementing it?
Well, I think on the language side, in the addiction space, there's sort of two different, I think, buckets to really dig into. One is that we need to make sure we're not using stigmatizing language.
Hmm.
When we talk about this disease space in stigmatizing terms or terms that are sort of weighted in blame and shame, that we are not reiterating that this is a health condition. We are not using language from the DSM-5 or, from sort of that health space. And I think that pushes people and families away from engaging instead of bringing them closer in. So helping people to understand in a non-judgmental way, that we're avoiding terms like addict or other pieces, or even substance abuse. Abuse is sort of a criminal justice term, like elder abuse and child abuse and animal abuse. And instead, we talk about a substance use disorder, which is a health condition with a diagnosis that affects different parts of your body. But you also have amazing treatment options that are available, and we can recover. The prognosis is actually pretty positive for a diagnosis of a substance use disorder. So I think that first bucket is making sure that we're using health-focused, non-stigmatizing language. And that signals to our entire community that are affected by this illness, both patients and families, that we are looking at this and working on it from a healthcare or public health lens. The other
Yeah.
bucket is on the language side, is making sure that our content is accessible to those that we need. When it comes to addiction, there are so many fields and spaces and lanes that we need to have at the table with us, right? This is a pediatric brain disorder, or health condition that's most likely going to begin in middle to high school years. So we have all the folks that have contact to help make an early diagnosis, prevention potentially, early treatment if necessary, whether that's school systems and educators, pediatricians, family physicians, parents, caregivers, sports and coaches and after school programs, you name it. And we don't have great integration and information that we've given to those spaces so that they can help individuals who are struggling or are starting to struggle, or help us prevent this illness in the first place. And so whether that's the access to adolescents or youth, or we're looking at criminal justice professionals or folks that are in healthcare, and the patients and families themselves. Language on how we prevent, treat, and recover addiction needs to be accessible, and we need to know that we're giving people tools that they can actually use.
Yeah. Again, I don't want to beat this because it's a whole other conversation, probably. But again, I mentioned the term politically charged. We are living in this world where, nothing is beyond the reach of politics, even, medicine and all this. And it just adds another element to be concerned about, or just another point of contention and friction in the process. Anyway, I mentioned that we're going to get back to the topic of family. And because you allowed me to give that plug for Chestnut, I'm going to give you an opportunity to plug your book, Understanding Addiction, A Guide for Families. So, what were you seeing that made this book necessary and important?
So I've been thinking about putting this together for a very, very long time. I do this work as an impacted family member. So I started in the field at, 15 years old, volunteering for a local nonprofit organization, and worked in the field through college, and have sort of dedicated my career to this work. But it really is because of that personal impact. And both my parents struggled with heroin use disorder. In my early years were a little bit chaotic and oftentimes homeless. And I was put into the foster care system and then placed with my grandparents to be raised by them. My mom did find recovery through a drug court. I don't think it was called a drug court back then in the 80s, but she found a methadone program and a culturally appropriate treatment program and recovery housing specifically for Native Americans that was very helpful to her. And she had a number of years in recovery and stability and became my best friend. My dad never found treatment and recovery, and when he passed away, he was only 48 years old. And I remember though that that year, a few months before he died, he called and said, "I want," he called me Jessa Marie. So Jessa, I think it's time. I want to get into treatment, and he wanted me to help him find treatment. And at the time, I was working. I just graduated from college. I'm 21, 22 years old. And I was working with the Office of National Drug Control Policy, with the Drug Czar's office on the
Oh,
Drug
God.
Abuse Commission. And it still was so difficult for me to find treatment and the resources that he needed. I didn't understand acronyms. I didn't know what an OTP versus a PHP versus an IOP. There's lots of clinicians that have probably listened to your podcast, but if you think about it, when you're a daughter or a mom or a dad or a sister, a spouse, a partner, and you're trying to help someone you love and they're so at risk, you know they're at risk of a fatality, that these are very scary times, and you're in crisis yourself and worried about someone. And then the process of trying to find some place to go is so hard. There was wrong numbers and things that were so expensive that it wasn't sort of a possibility for us. There was parts that felt a little seedy, like, can you Western Union me money and then I'll tell you what you should do for your dad? It was a hard couple weeks. I did find treatment for him, but for my dad it was too late. He had had so many illnesses and infections and things that had gone sideways while he was in active addiction and homeless. And so he passed away just a few weeks after that. But I knew in that moment that there was something wrong with how we help people in need and how we don't simplify or make it clear where to go for help and how to find evidence-based quality care. And so it took me 7 years to write this, but I put together a book.
Oh, hold on a second. 7 years to, you were working on it for 7 years, or it took you 7 years to think about it and then finally sit down and write it?
No, it took me 7 years to write it. I think I was thinking about it since I was in my 20s and my dad passed away. But when I started APF and I still couldn't find a resource that would have helped me as a 20-year-old, worried about my own family member. I really wanted to help fill that space. I made a program and a training for families, but I have 400 instructors. I don't have a instructor in every hospital in America or every county yet. So how could we make this low barrier and as easily accessible as possible? So it's a $7 ebook on Amazon, and I put an Audible together for my son. My oldest son really wanted me to make sure I recorded it in my own voice. And really, it is everything that we've worked on to gather the risk factors for a substance use disorder, what early intervention looks like. It details 57 evidence-based interventions that have amazing amounts of literature and science that let us know that they work, but they're still vastly underused and underutilized. And I interviewed 7 experts and clinicians in the field and really tried to put together what I wish I had access to when I was 22 years old.
Yeah, it also sounds like the kind of thing that's going to require regular updates.
Yeah, it's a wonderful thing, but I probably am going to have to update it pretty regularly or put something up on my website because we have so many innovations and tools in our toolbox in the substance use disorder space. But most families and communities don't know about that. And I think that's something that we can and should change.
Is there is there a piece of guidance for families that's particularly important because maybe it's something that's easily overlooked?
I think there's lots of pieces that families need to have access to because addiction is a pretty complex chronic disorder, right? So I think on the prevention side, families can know more around how to prevent this illness. We know that your genes account for a pretty big portion of your risk of developing an SUD. So making sure your children and your family, your extended family know about that risk if you have a family history. For example, making sure people and families, parents, caregivers, even adolescents themselves know that age matters. The age at which you begin using alcohol, cannabis, or nicotine is a pretty significant risk factor. We did some research at Addiction Policy Forum really trying to chart the patient journey through treatment and recovery. And when we dug into onset and progression, our study showed that the average age of sort of first use and when you started using substances for our patients was 14 years old, with the youngest of 5 and the absolute oldest of 19. So it's really important that we make sure caregivers and adolescents know that the adolescent brain is more vulnerable than an adult brain for substance use and the why. And then there's more risk factors. Let's say if you have a family history or sort of a genetic predisposition, like I am assuming I do. So I'm always been very careful, and I tell my teenage sons to be very careful as well because that's a risk factor that we don't talk about enough. I think on the treatment and recovery side, one early intervention, every illness that you can think of, we know and we know sort of instinctively, and we're taught that you should get screened and assessed and get your annual checkup, and that early intervention is key. In the addiction space, we still have myths like waiting for rock bottom that prevent people from intervening earlier. And you have more resources, the illness has done less damage when you start addressing it as quickly as possible. So making sure that we tackle myths and
Mhm.
make families and individuals know what early intervention looks like, making sure people know what the signs and symptoms are of substance use disorder. If you look at the 11 criteria in the DSM-5 and how you can diagnose an SUD, needing more of a substance to have the same effect or building tolerance is one of the 11. But we have some social constructs that think it is healthy or beneficial, or if you can hold your alcohol, or I can, drink more than others, that this is somehow a sign of strength or something to be bragging about, when actually it's a symptom of having an alcohol use disorder or a substance use disorder. So I think, like every other chronic illness, we need to have access to the full continuum from prevention, early intervention, treatment, and recovery support.
Yeah, yeah, well said. Again, Understanding Addiction, a guide for families by Jessica Hulsey, available at Amazon as an ebook. Jess, last question, or just last thing I just want to talk about. Nobody knows better than you that advocacy work is often selfless, unheralded. You win battles in a never-ending war. How do you get up in the morning knowing each day, you're never going to be able to plant a flag and claim victory every day? You're doing this work and doing this work, and or is that the wrong way of looking at what you do?
I've been, an advocate in this space for, over what, 30 years now. It's been sort of the work of my life. And I find that there's the little wins and the progress and the pieces that move you forward or down this football field or the this space that get me excited and motivated and keep me working hard. Setbacks happen. There's some times and environments that are more challenging, but since I started working on the policy space, we've gotten a prisoner reentry bill signed into law that's called the Second Chance Act. And every year we get appropriated, Congress just appropriated for this current fiscal year, 117 million. There's been thousands of communities that have found resources and implemented ways to make sure that people coming out of prison and jail, both my parents were incarcerated related to their substance use disorder. It's a high risk time coming out for an overdose and an overdose fatality. Lots of people, and the majority who are incarcerated have a history or have used substances. And so we know that there's a huge need there, and we've made progress. So that's, things like this. And every time that we have a new champion or a new bipartisan victory that keeps this issue moving forward and providing resources to those that are out in the communities, that's a sort of a daily win. We did that when we started Addiction Policy Forum. We started working on resources on the treatment and recovery side with the Comprehensive Addiction and Recovery Act. And right now we have $189 million for CARA appropriated this year to go out to communities. So I feel like you have to celebrate your wins and tell the story of the impact of resources or programs that you've established or changed or policies you've changed. And then every time you bring someone new onto your bench to care about an issue or to educate someone about the importance of medications for opioid use disorder, the importance of overdose education and naloxone distribution, every moment of education and bringing someone into the fold is a win.
Well, I want to thank you for leaving us on that upbeat note. This is not a topic that lends itself to that kind of spirit. So I really do appreciate it. I really do appreciate spending time with us today, Jessica. Thanks so much.
Thank you so much for having me.
Today, I spoke with Jessica Hulsey, President and CEO of the Addiction Policy Forum. She joined me today from her headquarters in Potomac, Maryland. This is Charles Epstein for the Catalyst Podcast. Thanks for listening.